So I'll start by introducing myself. My name is Dr. Taslim Alani-Verjee, and I am the director and founder of Salem Center for Mental Health. I'm a registered psychologist, and I'm here today to talk to you about how to take care of yourself when by yourself. Now, why by yourself? Well, right now is a period that they're calling social distancing. What I would prefer to call it is physical distancing because while we're being asked to keep, a healthy 2 meters apart from one another right now, that doesn't mean we actually need to be socially disconnected. This is actually a time for us to really be able to come together, not physically, but emotionally, and to not distance ourselves from one another. And so this can be really challenging for a lot of people. There have been a lot of changes that have happened over the past couple weeks. It might feel like day after day after day, there's a whole new set of changes. And just when we're starting to wrap our minds around one thing, we're starting to feel something else happen or notice something else happen. And for many of us, this is probably the first time we've ever had to stay at home for this period of time, not see our family and friends and loved ones for this period of time. And so this is new and this is hard. And so, what I wanted to do today is walk us through some of the things that might be going on emotionally, and then also walk us through some strategies that we might be able to use in the future, or maybe even starting today, maybe even starting during this webinar, that we can use to help get us through this period of time. One of the things that's really important to remember is that we don't know how long this is going to last for, which can come with feelings of uncertainty, not really knowing how to then deal with it because it is an undefined period of time. However, with that comes an opportunity as well. So we'll dive into that a little bit. Let's start by talking about stress. Where does stress come from? Stress comes from either being faced with something that's too big, we don't feel like we have the capacity or the resources to deal with it, or when we're faced with something that's dangerous or threatening to us. And so when it's something that's too big or we don't have the resources, we might start to feel powerless. We might start to feel stuck. We might not know, we might need to fight, but not necessarily know how to fight or whether we would even be able to face the challenge. When it's a threat, then we might feel like we're at risk, someone that we care about is at risk. In the case of COVID-19, or coronavirus, as many of us call it, it's a little bit of both of those things, right? This is a really, really big problem. And we haven't been given a whole lot of big tools to deal with it. We've been given small tools like stay at home, which doesn't quite feel like it fits the size of the problem, or wash your hands, which again doesn't quite feel like it fits the size of the problem. Keep apart from people, don't touch your face. These are things that are really small gestures, but in face of a really big problem, these feel like they aren't enough. The other part of this is that it is actually a threat to many of us. I mean, we've been hearing about older adults being at higher risk, those who have compromised immune systems being higher at risk. But this is actually a pretty big threat to the entirety of society, not only in terms of our health, but also in terms of the economy, the future of our education. All of these things are really new, and we don't know what we're going to do with it. And so these are clearly sources of stress for us. There are a lot of unanswered questions, and when we just don't know, we feel like we don't have control. And that's a really scary thing, especially if you're someone who likes to have control, who likes to have a plan, and who likes to follow that plan. Anxiety is when we have a buildup of stress. Now, this can be through small things that are happening that are stressful, and so that buildup of stress is happening, or it can be through a large event that is coming up. Stress is not always negative, sometimes stress is positive. However, either way, our body is preparing for something big, usually some sort of performance. Stress can be pretty helpful because if you imagine getting ready to run a marathon, you want your body to be ready. You want your body to be pumped. If you have an upcoming exam, you also want to have enough stress and therefore motivation in order to be able to study and to practice. However, when it gets too much, for example, when you're getting ready for a race or to take an exam, If anxiety is too high, it can actually lead to a deterioration of our skills and ability. And so it's about striking that right balance. Some of the symptoms of anxiety might include a racing heart, our thoughts going a mile a minute. We might feel jitters, we might feel tingly, we might sweat. Um, we might feel some funny feelings in our tummy, almost like when you're going down a roller coaster. These are all symptoms of anxiety. They're all very normal. Sometimes, however, we can experience those symptoms of anxiety that come really fast and we don't know what to do with them. And those are when anxiety symptoms can become a little bit more problematic. But really, what our bodies are doing is preparing to either fight or flight some sort of threat, or fight or flee some sort of threat. And so, when our bodies are preparing for this, that means we need to exert. In the case of right now, what's actually happening is that fight is actually to stay home and do nothing. And so we might be feeling this buildup in our body of stress and anxiety, getting ready for the big threat that's in front of us, and we have nowhere to exert that energy. And so that can also lead to further buildup of anxiety, further feeling of powerlessness, and further feelings of lack of control. Then there's grief, and I wanted to touch on grief, and I have a fun picture up here because there's also stuff to be grieving right now. Um, Many of us know about the 5 stages of grief. We might know that we don't necessarily always go in the cycle in the same way. We might bounce around a little bit. But right now, when we first started hearing about COVID-19, we may have thought to ourselves, well, this is not a big deal. Even though people in other parts of the world are getting sick, this is not going to affect me. Then we may have jumped to some anger, right? Of why is this happening? This is not supposed to be the case. Why am I being asked to change my behaviors, to change my life, to stay at home? We might experience some sadness or some depression, right? Not knowing when this is going to end, how we're going to move forward, what our life is going to be like. And then we might bargain. Well, if I stay home for 2 weeks, I can do the 2 weeks. And if I stay home for the 2 weeks, all of this will be better, right? That's how this is supposed to work. So that's the bargaining. Now, unfortunately, what we'll likely find out is that it's not going to be 2 weeks. I don't know how long it's going to be. But when we start to find out that things are actually extended for longer periods of time, we might continue to go back through this cycle. What we want to get to is that acceptance piece. Now, that acceptance piece means recognizing that this is the reality of the situation. It doesn't have to be crummy. It's okay that it is crummy. But once we can accept that this is the situation right now, then we stop struggling through it and we potentially seek to find meaning through it. For us right now, we might be grieving the change of the situation. We know that things will never go back to the way they were before. Much like any big world event or even a big local event that changes society, this is one of those momentous events. And so we know that things won't go back to the way they used to be. Some things might change for the better, like potentially the opportunity to work from home. But right now, that doesn't feel so good. And then we might also be grieving what is to come. For example, we might know that the situation is probably going to get worse, but we can't see it with our eyes yet. And this is called anticipatory grief. So, for example, you might have felt this if you had a loved one in the hospital or who was going to pass away but hadn't passed away yet. And so we know we're going to be grieving. We know something is about to be lost, but we can't quite put our eyes on it yet. So this might be some of the things that we're feeling. We might be feeling overwhelmed, powerless, out of control. We might be feeling stress and anxiety. We might be feeling grief. We might be feeling some of the emotions within the grief cycle. And all of this is completely normal. And so if you're asking yourself why you're feeling so many emotions, and especially if you're feeling like your emotions are going up and down throughout the day, that's completely normal. This is new and it's not pleasant for most of us. And so feel what you're feeling. But there's also some things that we can do to regain control and to take care of ourselves. For example, we can start noticing how we're feeling. And the Mental Health Commission for Canada has actually come up with a pretty neat continuum, and I'll post this on the website so that people can access it later. But this is a way for us to find out how we're feeling. So it goes from green to red, where green is on the healthy end. And that's when we're feeling normal, whatever our normal is. We might be experiencing fluctuations in our mood, normal sleep patterns, feeling physically well, like we have energy, we're feeling motivated, our performance is fairly consistent, and we're socially active. When we move to the yellow, that's when we're starting to react. That's when we might experience some nervousness or some irritability, some sadness, even. We might experience some trouble sleeping. We might be tired or experiencing low energy, have some headaches, engage in procrastination, and we might decrease our social activity. If we move further along to the orange, that's when we're considered injured. We might experience anxiety, anger, pervasive sadness, and hopelessness. We might be feeling restless or having disturbed sleep. We might be experiencing fatigue, aches and pain, decreased performance, not necessarily showing up to the things we're supposed to show up to. And we might be avoiding social engagements and withdrawing, even from people we're pretty comfortable with. When we move even further to the red section, that's when we're ill. Now, when we're ill, we might experience excessive anxiety, we might be easily enraged, we might be experiencing depressed mood. We might be unable to fall asleep or to stay asleep. We might be exhausted and we might become physically ill because our immune system is being compromised at this point. We might be unable to perform our regular duties. And again, we might not be showing up to the responsibilities that we've committed to. And we're probably isolating ourselves at this point. So I just want to ask everyone to take a second and to think about where they are on that continuum. Are they feeling healthy and well? Are they in the reacting or the yellow zone? Are they in the orange zone? Are they in the red zone? Knowing how you're feeling can be extremely helpful to being able to figure out what you want to do about it. And depending on how far along you are in that continuum, you're going to need different strategies. Usually, we tell people if they're in the orange or the red, it's a really good time to take some serious intervention. Now, this might be seeking out professional help. And there might also be a chance for us to connect with others in a way that we usually don't. We might just ask for help. We might ask loved ones to drop off some food. Asking for help can be extremely difficult. And I see some people commenting here that they're, in different areas of this continuum. No matter where we are, there's always stuff that we can do to work on it. And so some of the things I'm going to walk us through are things that we can do to work on some of this stuff. But at the same time, for each and every single one of us, what these strategies look like and how well these strategies are going to work is going to be different because we're all different. Not one of us has the same needs and reacts to things in the same way. It's always okay to talk about it, though. Reach out to loved ones. Even when that's feeling like it's the worst thing you could do at this point, like you don't want to talk to anyone. Usually, when we're feeling that kind of like depressed mood, where we feel like we have zero energy, the little acts that we can take can make such a big difference. Even things like going for a shower, going for a walk, eating a vegetable. All of those things can make such a big difference when we have been neglecting taking care of ourselves or when we feel like we have no capacity to take care of ourselves. The other thing we can try to do is to balance our thoughts. Our minds are extremely creative and wonderful, but sometimes they take us on a journey that's a little bit far away from where we ought to be. So, for example, our minds might be telling us right now that everyone is going to get sick and that a lot of people are going to pass away. Our minds might be telling us that we're going to be stuck at home forever and this is never going to end. Neither of those things are true, right? They have some trueness to them because we don't have enough information, but we have a little bit of information. For example, we know that not everyone has become sick here. Not everyone has passed away here. And if we look at even some of the worst examples in the world, not everyone is sick right now. Not everyone is passing away. And people are actually recovering. Cases are going down when the right interventions are being taken. For the example that we're going to be stuck at home forever, the reality is we're being stuck at home right now so that we don't have to be stuck at home later. And so if we can engage in this right now, we can remind ourselves that this isn't a forever thing. We're not going to be stuck here forever. People wouldn't have that, so we're not going to be stuck at home forever. By being able to identify when our minds are taking us on a journey that's a little far away from what we know to be accurate, bring it back. It doesn't mean to deny yourself your feelings or to deny yourself the fear in the thoughts, but rather by taking the evidence that we have in front of us and allowing for a more balanced thought. The other strategy that we can use is to focus on what's in front of us. We might be engaging in a specific task. We might have some beautiful art that we can look at. Whatever it is, focus on what's in front of you. Try to let go of any distractions that you have. We all have them. Thoughts that come into our head, emotions that we're feeling. None of them are wrong or bad. But when we're focusing on something, really seek to focus on it. Engage all of your senses in what you're doing and focus. That gives your mind a little bit of a break from the intrusive thoughts and the uprising of emotions that come with those intrusive thoughts. We can also work to take care of ourselves, and that's taking care of all of the parts of ourselves. That means eating well and eat what's good for your body. And for some of us, that might mean different things, and it doesn't matter. It doesn't matter what people say is healthy or unhealthy. Listen to your body, tune in, and honor where it's at. The other thing is to stay physically active, and we're going to have a webinar next Tuesday by the lovely Yassine, who is a social worker on our team, who's going to walk us through movement and mental health. But being physically active is so important because, like I said before, we have this energy building up inside our bodies. If all we're doing is sitting the entire day, the energy has nowhere to go except for the nervousness. And so the nervousness builds. And so if we can find ways to be physically active, that's great. There are a lot of online opportunities for physical engagement. We're also still allowed to go outside and go for walks as long as we're staying about 6 feet or 2 meters away from people. And so, as long as you don't have any symptoms of illness, go outside, go for walks, get some fresh air. Just do so cautiously. We can also take some time to engage our minds by learning new things, by channeling our creativity, by thinking about all of the things we've always wanted to do. If we just had a little more time, now's that time. We have a little bit more time, whether it's because you've saved time in your commute, maybe you've been laid off, maybe you're still on an extended March break. Regardless of what it is, you have a little bit more time. Do the things you've always wanted to do. This is that time. Channel that creativity, find that purpose, and engage yourself. It might be hard, but structuring your day would become really helpful. And so make a routine for yourself. Continue to wake up at a consistent time. Continue to shower. Continue to eat your breakfast. Change out of your pajamas. Structure your day, regardless of whether you're working or just at home. Structure your day so it doesn't feel like it keeps running on forever until you don't have anything left to do except sleep. So that's a really helpful thing. Being able to chunk your day as well as chunk your weeks is also going to be helpful so that you know that you're still achieving things, even if you're not going very far. And so being able to recognize that when we don't chunk or we don't routine and schedule our routine, we might start to feel like we're accomplishing less. We might start to feel a lack of purpose. And this can obviously be detrimental to our mental health. Find time for fun. There are still lots of ways to have fun, whether it's reading a book, whether it's trying out new recipes, whether it's learning how to knit or crochet or cross stitch, as I learned that some of my friends are doing. Whatever it is, learn how to do a new thing. Do that thing, have fun, play board games with your family if you're with people. There are also lots of apps where you can play games with loved ones via the phone or on the computer. This is a time to have fun, so do it. The other thing that I've been learning and that research has been telling us is that social media has been bombarding us with information, which is obviously not helpful. No matter what time of day you look at your phone and you scroll through it, there are new news articles, there are new findings, there are new people posting or ranting about something related to COVID-19. One of the best things that we can do for ourselves right now is to stop looking at our social media, or at least to control it. We don't need to be checking in on what's going on in the world every 20 minutes or every 5 minutes. We don't need to be spending our day scrolling. It's not good for our mental health, and it really, really can be negatively impactful on our sense of selves. So control it, right? It might be deciding that you're going to look at it 20 minutes a day in the morning and 30 minutes a day at night, and that's it. And I mean, we live in an age where people are constantly on their phones. And so it's not to say don't use social media at all, but maybe create different accounts for now or mute some of the people that you follow so that you're not constantly being bombarded with the same negative news cycle. It might be nice to watch some animals or to look at new recipes or to look at cool vacation spots. Things that aren't just negative news that consistently make us feel down and powerless and like we're in crisis. It's not to ignore the reality of the situation, but clearly we know the reality of the situation. Just shift your mind to something else for a little while when you need to scroll. Or when you need a mind break from what you were focusing on, pick up a book instead, or listen to some music, or stretch. It doesn't always need to be scrolling through your phone. And all of those things will give your mind the break that they need, but they'll also give your spirit the break that it needs. In this time period, we might be feeling like there's a lot of stuff that we can't do and a lot of stuff that we can't control. But that's not actually the case. There is still so much that we have control over. But again, we're being bombarded by messages of all the restrictions. And so make a list. Make a list of all of the things that you can currently control. For example, for the most part, what you're going to eat, what you're going to wear, how you're going to spend your day, who you're going to talk to, what you're going to watch. All of these things we still have control over. How we're going to spend at least some of our time, how we want to plan the rest of our lives. These are things we can control. And so let's not get bogged down in the stuff we can't control. Make a list of all the things you can control and start reclaiming some of that control. The last thing I want to say is if you start to feel like things are getting too hard, like you can't manage, you're not able to do your day to day anymore, it's probably a good time to reach out for help. And so when you're thinking about reaching out for help, again, that might be a loved one, someone that you care about, someone that you know has generally been supportive to you. And it's good to pick those people strategically. We might have friends that are really good at providing advice and strategies. And sometimes that's exactly what we need. And sometimes what we really want is just someone to listen to us, to hear us, to validate us, to hold our hand virtually or emotionally. And so pick the person or the people you know are going to be there for you in the way that you need at this time. It's also okay to enlist the help of a professional. And so that might mean your family doctor, it might mean calling upon a mental health professional. Regardless of who it is, know that it's always okay to ask for help and it's always okay to feel like you do need help. You probably have people to call on or people who call on you when they need help. And so it's a reciprocal relationship and it's okay. It's okay to take advantage of that reciprocity. That's what friends and family and community are there for. I see someone commented that, what if you don't have anyone to listen to you? Sometimes that happens. And so being able to enlist the help of a professional during those times can be really helpful. People also find that journaling can be nice because when it's journaling, you're really the only person who's listening, and then you don't need to hear other people's feedback. And so you can let yourself go in an uncensored way. But if you're looking for someone to really hear you and you don't necessarily know who those people are, reach out to a professional. Professionals are trained and they can provide you both with that validation and that warm, empathic support, but they can also help you find strategies, which might mean identifying people in your life that you could call upon in the future, or being able to help us get through the mind traps because we might actually have those people right in front of us. We might not know how to reach out to them, or we might feel uncomfortable to reach out to them. So a professional would be able to help with all of that. So my last little sheet of paper here is a contact us. And I have a feeling that this is being presented backwards, which is unfortunate, but it is what it is. So we can be reached at admin@silmentalhealth.com. And I'm just going to type that into the comments. And we can also be reached by phone. Oh, thank you, Mona. I'm just finishing typing that too. Um, so those are ways that we can be reached at Salem Center for Mental Health. We do offer single sessions, and so if that's if that's something that you would find helpful, just to have one time or one or two times someone to talk to figure things out with, we can offer that. If you're looking for more long-term support, that's also something that we would be able to do. But it's always okay to reach out for support. There is nothing wrong with it. Our services are confidential. And right now and always, we also offer a sliding scale, which means that regardless of what your finances are, we're going to find a way to support you. Unfortunately, most mental health services in Canada and Ontario specifically are fee for service. And so, one thing that we try to do is to ensure that the barriers are limited. And so, reach out to us whenever you need, and we will respond and we will be there for you in the best way that we can. Thank you so much for everyone who attended. We have a list of webinars that are going to be coming up starting next week, and we hope that you will come to join us. We also hope that there won't be so many technical difficulties. This is a bit of a learning curve, but we will hopefully do better next time. Thank you for joining. I hope this was helpful. And if you have any ideas of webinars that you'd like to see in the future, or if you have specific questions, also feel free to reach out. And we'll try to get back to you as soon as we can. We want to make sure that we're supporting the community in a way that the community needs, and we can't always predict what that is. So let us know how we can be there for you, and we look forward to being there for you now and in the future. Thank you.